Is Abbott the second one coming to market after Gilead? Who's the second company that's marketing their stuff next?
It's AbbVie, which is used to be called Abbott. Abbott Pharmaceuticals out of Chicago, but then Abbott split into this AbbVie, which is the
How do you spell that?
ABBVIE.
Okay.
A friend of mine has been diagnosed with pulmonary fibrosis, and I'm just wondering, is there a connection between the disease in the lung versus the liver?
Does he have hepatitis C?
No.
Okay. We have some liver diseases that are associated with pulmonary fibrosis. They're usually autoimmune diseases. I've seen that happen with both primary biliary cirrhosis and primary sclerosing cholangitis, for example. So there can be the coexistence in a single patient of those things. When you look at, the association, typically it kind of falls apart, meaning that the incidence of the pulmonary fibrosis is such, and the incidence of, say, the liver disease is such that there's a random occurrence of the two together that could occur in one patient out of 10,000 or something. And so far, for some of these things, it seems like they're associated but not connected. So there's random occurrence in the same patient happening. But when you see it as a doctor, you draw a connection and you say, well, these got to be connected some way, but we don't clearly know how those kinds of things are connected.
Under the microscope, are they the same?
The type of fibrosis, actually, I don't know about the microscope so much, but molecularly they probably are different collagens, different types of fibrosis, and actually different mechanisms of fibrosis. There's something called a connective tissue growth factor that we're actually studying that has multiple, it's an amazing molecule. It has multiple modifiers or promoters and suppressor regions, and many different hormones interact with it. And in the lung it works one way, and the liver works another. And so the same molecule can act differently in different organs too. So it's a complicated system. I'd say that the fibrosis in the lung could operate through different mechanisms and pathways than the fibrosis in the liver, but there's some relatedness there. So Betsy, you had a question?
I know that grapefruit can interrupt the efficacy of some medications.
Yeah.
And what about the kinds of medications?
Yeah, I think for a lot of these it is recommended to avoid grapefruit juice and pomelos. Yeah, see, I love to throw that out. What the heck's a pomelo, right? We're in Colorado. We don't know what the heck a pomelo is, but if you were in Florida, you'd know what a pomelo is. It's like a grapefruit. It's in that same category, yeah. So something about the grapefruit, there's a chemical in the grapefruit that affects the metabolizing enzymes, and there's a protein called P-glycoprotein, and it affects that. So it influences the immunosuppressive medicines, and it can influence particularly protease inhibitors like ABT450. I don't think it has much effect on sofosbuvir. Probably has a little effect on ladipasvir, would be my guess.
Yeah, and they don't have it in the package insert or anything, but it is just a slight effect in those two.
So what about for AbbVie's drugs? Do you think that'll be a notice about avoid grapefruit?
I think it'll be in the package insert.
So he's betting it'll be in the package insert, but we haven't seen it. Yeah. Back wall.
Early in the meeting, you were talking about, like with hypertension.
I forgot.
Like
Propranolol, yeah.
You were talking a little bit about comparing those as far as which ones do what and which would be a better choice for hypertension.
Yeah.
Can
So
you explain that again?
most hypertension that you get and that doctors treat has nothing to do with your liver. So most of those medicines, all those classes are fine, okay? What I was saying is when you have cirrhosis, one of the complications is you build up pressure inside your abdomen in those veins. That's called portal hypertension. And there's a class of medicine that's used to treat that. They're called beta blockers. but a particular type. And the two drugs that are used for that are propranolol and nadolol. But patients get confused by that because the doctor will say, well, I want you to take this medicine for your portal hypertension. Well, they don't hear the word portal, they hear the word hypertension. And so when they come to see me, they'll be on nadolol or propranolol, and I'll ask them, what are you taking that medicine for? And they say, oh, it's for my hypertension. And I said, well, your blood pressure is fine. What do you mean? Well, they said it's for my hypertension. I said, well, they probably put it on you for your portal hypertension to lower your risk of bleeding from the veins in the esophagus. So it's a typical medicine used to treat a complication of cirrhosis, but it's not those drugs are typically not used for standard hypertension management today. They used to be in the past, but not commonly today. So if your doctor prescribes ACE inhibitor, lisinopril, atenolol, Norvasc, any of that stuff is fine to treat standard hypertension. Yes, we had a question here.
I don't have any question, but I have a comment, which is we should appreciate the unvisible, all the researchers and the study people, you and all and behind you, and become guinea pig that patients we appreciate. We have this high cure rate. Almost all of us can be cured, and then I just instead of be headache for the price, my attitude is there is cure, just happiness. Somehow we figure out the price. This is the low part. We work with low priority. We worry, and then every people, the doctors, guinea pig patients, and the studies, and pharmaceutical big heads. We appreciate them. That's all I want to say.
Yeah. Yeah.
Hi. I just finished the Sovaldi Alicio treatment, and I was wondering, how long does it take for that drug, when you take the oral drugs, for it to clear your system and you start feeling normal?
I didn't hear your comment or question, sorry.
Oh, okay. I just finished the Sovaldi and Alicio combo,
Yeah.
and how long does it take those oral drugs to clear your system?
Probably about 2 to 3 days, given their half-life.
Yeah, I would say within 5 days, they're pretty much gone.
Okay. And if at the 12-week blood work you find out that you are not at the cure, what are your options after that?
Options for?
For getting cured if this didn't work?
Oh, well, we're dealing with that because we have had some people relapse after what you're taking. And there will be strategies. We have, right now, our recommendation is to use a long duration, 24 weeks, of Harvoni plus ribavirin. We don't have any data to support that, and most insurance companies will probably deny it. So
What about the new drugs? You can't try the new drugs?
that's what Harvoni is a new drug.
See, that's what I was afraid of, getting insurance to do this a second time. You're probably in trouble.
Yeah, it's going to be a struggle. There'll be a lot of letter writing and appealing and stuff like that.
We've already been through that.
And I would say we're doing a small pilot with AbbVie actually. I'm not sure it's even started yet, but we are looking at the AbbVie 3D, 5D plus Sovaldi.
Now, something I never understood
6D.
is if you have your zero viral load,
Zero viral load.
how is it that you relapse? Where does the viral load, how do you get a viral load?
Well,
It's been at zero.
it's not zero is what Jacob said. When a relapser, the test reads out 0, but there's still probably a very low level of virus that's just not detected. But the good news is that most of the commercially available RNA tests today are very sensitive, and when you get an undetectable level, that's very good news, and typically does connote cure.
Thank you.
Fellow in the back, and then this lady.
For those who have been cured of Hep C, who still have cirrhosis, what kind of research is being done, for options besides transplant? Are there any other research being done out there, or is still transplant the only option available?
Well, there's a whole, once you cure something, you go after something else, right? So there's a whole new thrust in therapeutics for the liver, which involves reversing fibrosis. So we're involved heavily in that discussion. And all I can say is there will be a number of trials starting next year here. Already there's a number of trials here, but in different disease categories, fatty liver disease and primary sclerosing cholangitis. But we probably will have 5 to 6 studies of new antifibrotic medications over the next 12 to 18 months. So the idea is you get rid of your Hep C, still have fibrosis, still have portal hypertension, take an antifibrotic, melt away the fibrosis, and now you don't even have cirrhosis.
Wow.
Yeah. If it works. Right, this, by the way, this is at the, listen, this is at the very early stages, so, there's no, the concept's great. The results, the data is what's important, right? So, this is going to go through phase 2 study, for example. One of the things I pointed, I don't know if you caught it, I showed you a slide of some research I was doing here on that one test of the liver function test. So I started that like 20 some years ago. And we actually did patent that technology beginning in 2007 and had 3 patents issued since December. And that particular testing platform is what's being looked at as a potential endpoint for some of these studies. Now, the FDA hasn't approved it, so it's not an FDA-approved test, but hopefully in conjunction with some of this evolving treatment, we might generate enough data to also show that that particular test, a non-invasive test, can be used as a measure of whole organ function and show that, hey, not only is your virus gone, but your liver health is being restored.
Is that the Colate test?
Yeah.
If you're treating Hep C in stage 1, 2, or 3 fibrosis, and you cure it, with the liver's ability to regenerate, can it not regenerate the fibrosis?
Yeah, it turns out that the fibrosis that's present before full-blown cirrhosis, I think a lot of that can resolve, and we've got biopsy data showing that. So in the days of interferon, when the SVR rates were pretty low, we had some small follow-up studies of biopsies after SVR, biopsies after cure, and there was a resolution rate of fibrosis, but it was, as you suggest, primarily in the patients with lower stage of fibrosis. But once you get to that, and there's different levels of cirrhosis. I mean, cirrhosis with portal hypertension is different than cirrhosis without portal hypertension. So if you have cirrhosis but no complications and no portal hypertension, that cirrhosis is more likely to resolve after clearing the virus. And there have been some patients with cirrhosis who have cleared their Hep C where on repeat biopsy the cirrhosis appears to have vanished.
But I got one other question.
But there's sampling error with biopsy too.
With the triple therapy, do you have any data on how many, what the percentage of reoccurrence was with that?
Are you talking about the peg interferon ribavirin telaprevir?
Yes.
Yeah. What the recurrence? What was your question? What
was the recurrence rate?
Relapse rate? Well, the relapse rate varied with this. The regimen was. We thought it was potent. It was potent for the time, but when you look at the chance to relapse was pretty high in the patients who had a prior treatment course of PEG-RIBA, and were null responders to that. The chance for a cure when retreated with the combination of the PEG, riba, telaprevir is only about 30%. And then if you threw cirrhosis into the mix for such a patient, the chance for cure was only 15%. So generally, most of it was, I would say half of it was virologic failure, but half of it was relapse. So relapse rates are pretty high in the cirrhotic treatment-experienced patient. Now, if you went to the naive patient with low fibrosis, there was almost no relapse. It was, the cure rates were like 90%, but that was a small percentage of the patients. One last question, lady here.
Mine sort of went with his. I was wondering, once you get cured, can your liver regenerate? And how much can it? How long does it take?
Yeah.
So.
Yeah. So there's like 3 components to the healing. The first component is the inflammation and the damage, and that actually heals up pretty quickly. So using that test that I told you about, within 4 weeks of being on these treatments, we saw improvement in function related to the immediate rapid resolution of the necroinflammatory change. So within 4 weeks of being on treatment. But thereafter, if you have a lot of fibrosis, there's almost no change for up to almost a year. But in the patients who have minimal fibrosis, there seems to be slow, gradual improvement over the course of the year. So time will tell. It's going to take a long time for the advanced fibrosis, shorter time for lesser stages of fibrosis.
Thank you.
Well, thank you, everyone. Let's show up.